Hi everybody, welcome back to UWorld's Next Gen NCLEX review session. My name is Jackie and I'm a nurse here at UWorld. We're so glad to have you guys with us today for our question drill set. So we are going to be walking through perioperative questions. So everything kind of right before surgery, during surgery, and after surgery that a nurse might be involved in. So make sure you guys use the chat today. Be sure and share this session. Invite your friends, the more the merrier. We want to help as many of you guys as possible. We have Samantha moderating the chat, so be sure and ask any questions along the way. And with that being said, let's go ahead and get started. We'll pull up our first question. All right, the nurse is caring for a client who is receiving moderate sedation during an endoscopy. It would be a priority for the nurse to monitor the client for option 1, bradypnea, option 2, presence of gag reflex, option 3, decreased capillary refill, option 4, hypoactive bowel sounds. All right, go ahead and put those answers in the chat. Let's see what you guys come back with. We have 30 seconds on the clock. We'll see how you guys do. Very good. It's so good to see so many of you guys on today. That's awesome. All right. And again, be sure you guys are sharing this session. Again, we want to help reach as many of you guys as possible, and follow us on your favorite channel. We have a ton of great content coming your way, especially as we're kind of kicking off a new school year for so many of you. So be sure you follow us. You won't regret it. All right, let me go ahead and pull up our correct answer. So our correct answer in this one is going to be option 1. Okay, again, when we see this question, we see the word priority is bolded. It's drawing our attention to that. So that's going to mean, we're going to prioritize these findings. Most important, a good rule of thumb for this is ABCs, airway, breathing, circulation. After that, we're going to focus on infection and safety. So when we're talking about moderate sedation, we're talking about being in a sedative state. So we're going to worry about respiratory depression, kind of same principles as like with opioids. So again, we're going to monitor for respiratory depression. A decreased respiratory rate is definitely something that can be concerning, can kind of tip the scales in an unfavorable direction for respiratory depression. Again, that's what we're looking for. That's what we're going to prioritize. When we're talking about an endoscopy, we're talking about going through the mouth to kind of look at the stomach and the upper small intestine. And so, at the end, we're going to be worried about the presence of a gag reflex. We want to make sure that we can advance our client's diet, but we're not going to prioritize that. We're going to focus on our ABCs. That's what we're seeing in option 1. Decreased capillary refill, this would be indicative of a C. So again, option 1 kind of still takes precedent. And then option 4, hypoactive bowel sounds, we're going to expect this. Typically, our clients are going to be NPO for a significant amount of time. They're not going to have a lot going through their GI tract, so we would expect to see this. All right, good work, you guys. You did awesome on that one. All right, question 2. The nurse is observing staff members caring for a client during a surgical procedure. Which of the following actions by a staff member would require the nurse to intervene? Option 1, the surgeon wipes sweat from the forehead and continues operating. Option 2, the anesthesia provider completes a timeout before administering general anesthesia. Option 3, the unlicensed assistive personnel count sponges before suturing begins. Option 4, the circulating nurse provides updates to family members throughout the procedure. All right, 30 seconds on the clock. Go ahead and drop those answers in the chat. Let us know what you guys think. And again, if you guys are getting ready to take your NCLEX, let us know when you're testing. We definitely want to wish you good luck, and we want to celebrate you once you get your results as well. So if you haven't tested, be sure and come back and let us know when you pass. Again, we're so thankful to be part of your journey to becoming a nurse, and we're in this every step of the way with you, nursing school, NCLEX, and beyond. So let us know so we can share in your joy and your celebrations, and be sure and tag us too if you do like a fun reveal video or anything like that. All right, I'm going to go ahead and pull up our answer. So our correct answer on this one is going to be option 1. Again, we see in this question stem the word intervene. So that means we're going to look for the action that's like false. It's not indicated. It's contraindicated. It's just something we shouldn't do. It's not right. Not safe for the client. So that's exactly what we're seeing going on in this question. So what we're seeing here is a break in the sterile field. So we can't have the surgeon who is in, kind of sterile from, head to toes, touching sweat, and then continuing to operate. That's going to cause the nurse needs to intervene. They need to kind of re-glove the surgeon and go from there. So again, that is not safe for the client. It's a risk for infection, and so that would be our correct answer on that one. Again, what we see in option 2, this is appropriate. We would expect the anesthesia provider to call a timeout before general anesthesia. The UAP can definitely count sponges. This would be the role of a surgical tech. And then option 4, the circulating nurse can definitely give those messages, updates to family members. So good job, you guys. Well done, well done. All right, question 3. The nurse is caring for a client in the PACU, or post-anesthesia care unit. The nurse notes the client has an elevated end-tidal CO2 level and muscle rigidity. Which of the following actions should the nurse take? Select all that apply. Option 1, monitor the client's heart rate and blood pressure. Option 2, monitor the client's serum potassium level. Option 3, initiate an infusion of warmed IV fluids. Option 4, administer oxygen via nasal cannula. Option 5, administer dantrolene to the client. All right, 30 seconds on the clock. Drop those answers in the chat. Let us know what you think. Again, this is select all that apply, so you're going to have more than one right answer. So make sure you do that, answer that way. Again, and be sure you guys are sharing this session and following us on your favorite channel. We have a great lineup of content. We come live to you guys a minimum of 3 days a week, so and more often. So again, just keep an eye out for all of those upcoming events as well, and be sure that you're subscribing so you can get updates. Very good, very good. All right, I'll give you all about 5 more seconds and we'll go from there. Good answers, everybody, especially on select all that apply. All right, so what we're seeing in this question, our correct answers are going to be options 1, 2, and 5. Okay, general rule of thumb, when we see select all that apply, we're going to take a true false approach to each option, but we're going to take a true false approach to what the question is asking us. So in this one, we're looking for the actions the nurse should take. So what kind of interventions we would expect in the client's plan of care, things like that. Okay, so what we're seeing in this situation is malignant hyperthermia. So this is a rare but definitely life-threatening condition that's commonly triggered by medications used for anesthesia. It can include inhaled anesthetics, certain paralytics, and then it can also be triggered by like stress, trauma, and heat. So the triggering agent is going to cause excessive calcium release from muscles, and it's going to lead to sustained muscle contraction and hypermetabolic state. So these clients, they're going to look like they have generalized muscle rigidity. So think about like your jaw, trunk, extremities being rigid. Hypotension, tachypnea, diaphoresis, hypercapnia, which means that increased CO2, and hypothermia, which is a late sign. So what we're going to do for these clients, we're going to discontinue whatever is the trigger is, the causative agent. We're going to administer IV dantrolene, which is a muscle relaxer, and we're going to provide respiratory support. And we also need to focus on lowering the client's body temperature. So think about like cooling blankets, ice packs, chilled fluids. So again, what we're seeing in option 1, this is in line with management for malignant hyperthermia. We're worried about that hypotension and tachypnea. Again, we need to make sure that we're monitoring those core vital signs for the client. Option 2 is correct as well. Potassium can be affected in all of this. And then option 5, dantrolene is definitely going to help relax those muscles. What we see in option 3, We want cooled fluids, not warm fluids. And you can kind of maybe question that one, knowing that this is malignant hyperthermia. We don't want to warm the client any more than they already are. And then administering oxygen via nasal cannula, we need to deliver 100% oxygenation. So like a bag valve mask. They're going to need more than what a nasal cannula can deliver. So good job, you guys. You did awesome on that one. Kind of a unique and tricky topic, but well done. All right, question 4. The nurse is preparing to teach a client who is scheduled for abdominal surgery next week. Which of the following information should the nurse include? Select all that apply. Option 1, avoid coughing to minimize the stress placed upon suture lines after surgery. Option 2, you will be instructed to arrive at the hospital a short time before the scheduled surgery start time. Option 3, you may need to have some diagnostic procedures completed prior to the day of surgery. Option 4, it is important that you follow the instructions of when to stop eating and drinking prior to surgery. Option 5, you will be able to drive yourself home on the day of surgery after spending a short time in the recovery room. All right, again, a select all that apply. Go ahead and drop those answers in the chat. I'll give you guys a little bit longer than 30 seconds, but let us know what you think. And again, for anybody who's just joining us, we are walking through perioperative questions, so kind of focused on that surgical element of nursing. So things leading up to surgery, roles of a nurse during surgery, and then after surgery as well. But perioperative typically is that surgical time, but it can also include preoperative and postoperative. All right, go ahead, drop those answers in the chat. I'll give you guys about 5 more seconds. And again, so good to see so many of you guys on here today. Very good. All right, so our correct answers on this one are going to be options 2, 3, and 4. So this was a long question, so I didn't put a little tip in here so you guys could still read everything. But again, what you're looking for is, what we would expect in a client's plan of care. Like, what are true statements? What are expected things we should do? So when we're talking about, just general teaching, education of a client undergoing surgery, we're definitely going to include what they need to know in advance of surgery, what they can expect during surgery, and then what teaching needs to be done for them to be safe and effective at home. So in what we're seeing in option 2, this is true. In most surgical settings, patients are going to arrive a short time before surgery. You don't need to be there significantly early. Option 3, you may need to have some diagnostic procedures completed before. This is definitely a valid, true statement. A lot of times imaging has to be done before to understand maybe locations of things, what exactly the problem is, if it's an obstruction, an ileus, anything like that. And then option 4, we want to prevent any risk of aspiration during surgery. So that's why we instruct our clients to be NPO. Typically, we're going to ask for 8 hours or more of restricting fluid and food. And again, this is all about preventing that risk of aspiration. We definitely don't want to, option 5, we don't want the client to drive home after anesthesia. A lot of time there's a lot of other medications involved too, and not safe to operate heavy machinery. And then option 1, we want to encourage that coughing and deep breathing. Again, that's going to help kind of prevent that risk of pneumonia or fluid buildup in our lungs. We want to keep our lungs moving and all of that. And then again, coughing to minimize the stress, that's only going to be if it's indicated, like craniotomy, tonsillectomy, things like that. All right, good job, you guys. All right, question 5. The nurse is completing a pre-procedure checklist for a client scheduled for surgical repair of the right anterior cruciate ligament. Which of the following findings would require follow-up? Option 1, the client has an allergy and fall risk band on the right wrist. Option 2, the surgical consent has not been signed by the healthcare provider. Option 3, the pre-procedure assessment reveals the client has decreased bowel sounds. Option 4, the healthcare provider marked the client's right knee with a permanent marker. All right, 30 seconds on the clock. Drop those answers in the chat. And if you guys are new to the UWorld community, I encourage you guys to check out our website, nursing.uworld.com. There's a ton of great information in there, a lot of great blog posts and information about the NCLEX, things that will help you be successful in nursing school. And of course, the heart and soul of UWorld, our product as well. So if you guys are new, check us out. You can try our 7-day free trial. There's lots of great questions on there to kind of give you a taste of, again, how UWorld will prepare you for your NCLEX. Excuse me. And you can see our explanations, our awesome illustrations, lecture videos, animations, all that good stuff. So, and of course, our NGN items. So be sure you guys check that out. All right, I'll give you guys about 5 more seconds. Great answers, everybody. And our correct answer on this one is going to be option 2. Surgical consent has not been signed by the healthcare provider. So this is like a hard stop. That's something that has to be confirmed before surgery can happen. If not, that puts the license of the healthcare provider at risk. Again, we have to make sure that everyone is in agreement, that the client has signed the healthcare provider, and there's a witness signature as well. So that can really place the whole healthcare team in a lot of trouble if these things go overlooked. So as an essential item to have surgery be completed. Again, we want to make sure that, in this checklist that we've noted any allergies. The client has confirmed them. We've asked them a million times, what are you allergic to? We've confirmed it on the wristband, the chart, the electronic medical record, that they have a fall risk. They're going to be a fall risk when they get up from surgery. And then again, pre-procedure assessment. We always want to assess the client, make sure that they're stable for the surgery that's getting ready to be performed. Again, we encourage these clients, anytime there's general anesthesia, that they're in NPO, nothing to eat or drink for at least 8 hours. Again, this can vary by provider, but a good rule of thumb is 8 hours. Again, we want to prevent that risk or minimize that risk of aspiration during the surgery. And then we definitely want that surgical site marked by the physician. A lot of times it's not going to be an X, maybe it's a circle or the word yes or the surgeon's initials, something that's going to indicate this is where we're operating. So this is totally appropriate, something that should be done. Everyone is in agreement that we are operating on the correct limb. So good work, you guys. You did awesome on that one. Moving right along in the home stretch here. The nurse is teaching a client who is scheduled for a bowel resection. Which of the following information should the nurse include? Select all that apply. Option 1, incentive spirometry should be performed once per hour when awake following the procedure. Option 2, you may require electrolyte replacement following the procedure. Option 3, discontinue eating solid foods at least 4 hours prior to the procedure. Option 4, a nasogastric tube may be required in the postoperative period. Option 5, strict bed rest will be implemented for 48 hours following the procedure. All right, select all that apply. Go ahead and drop those answers in the chat. Let us know what you guys think. Again, select all that apply. We're going to have more than one right answer. And again, just as you guys are answering, after you answer one more question for us. Are you guys already part of this UWorld community? Are you already using UWorld? Is this your first time here experiencing UWorld? Let us know how you're joining us and how you guys like to study. We love to know that information and, make sure we're providing you guys with the content that's doing the most good for everybody. So let us know. And as always, we're just so glad to have you guys here. If anybody's joining late, we're covering perioperative questions. And these, of course, will be available on demand on our social media channels. So if you miss any questions or join late, be sure and check those out and you can do more practice. All right, good job, you guys. All right, our correct answers on this one are going to be options 1, 2, and 4. So again, when we see what should the nurse include, just think about a care plan. What are those activity statements, those actions, interventions that a nurse should do in this situation? So when we're talking about kind of that post-operative period, we definitely want to encourage that incentive spirometry. It's going to help expand our lungs, move fluid, make sure we don't have any fluid buildup in our lungs, keep any post-operative risk down. So again, definitely do that every hour. We're going to teach them how to do this and, make sure that they're well equipped and doing it every hour when awake. We're not going to wake them up every hour when they're sleeping to do it, but again, when they're awake. again, talking about a bowel resection, if we're taking out a chunk of our intestine, we're shortening that digestive tract. So we might be losing some electrolyte absorption. So we may require some electrolyte replacement after the surgery. And then again, option 4, an NG tube. We might do this just to for some bowel rest, to kind of provide some suction or some drainage for anything that might be going on in our stomach while we let our intestine heal. So good job, you guys. Again, when we're talking about discontinue eating solid foods, we want that 8-hour window. We want to make sure that we have enough time for food to digest itself, make its way out of the system, decrease our risk for that aspiration. And again, we want to get clients up and moving as fast as possible. That's one of the kind of biggest, parts of favorable outcomes in surgery is early ambulation, getting clients up, sitting up on the edge of bed, getting them to a chair. It's all about baby steps, but we'd want to get people moving. There's very few things that we would implement strict bed rest for, especially for 48 hours. All right, good job, you guys. All right, question 7. The nurse is teaching a client about pre-operative instructions for a planned outpatient surgical procedure at 0800 the following day. Which of the following statements by the client would require follow-up? Option 1, I will eat a light breakfast the morning of my procedure. Option 2, I may require antiemetic medications in the postoperative period. Option 3, I will arrange for my spouse to transport me home following my procedure. Option 4, I understand that I may require a blood transfusion during the procedure. All right, go ahead and put those answers in the chat. Let us know what you guys think. And before we're done today with our last question, make sure you guys let us know how you did out of 8 questions. And you can always give yourself partial credit on those. Select all that apply too. So good work, you guys. Awesome, awesome. Again, so glad to see so many of you guys here today. Again, it's not too late to share this. The more the merrier, and this will be available on demand as well. All right, I'll give you guys about 5 more seconds. Drop those answers in the chat. Let us know what you think. Good work, you guys. All right, so our correct answer on this one is going to be option 1. I will eat a light breakfast the morning of my procedure. So again, driving this topic home, we want to decrease that risk of aspiration for a client. If they have a procedure at 0800, we do not, at 8 o'clock in the morning, we don't want them eating breakfast before. That's not enough time to let food digest and again, just decrease that risk of aspiration. So that is definitely something we want to follow up on. Again, when we see that requires follow-up, that's going to mean the option choice, it's not safe for the client. We want to intervene. We want to make sure that we correct what they're saying, correct that understanding. What we're seeing in options 2, 3, and 4, all of this is appropriate. So, kind of understanding what medications might be needed to manage side effects, especially of anesthesia. A lot of times that will make clients really nauseous, and so we need to give them something to help with that nausea. We're not going to encourage anyone to drive after anesthesia. And then in option 4, where the physician is really going to walk through those risks and everything to really for the client to understand, the risks, the benefits, expected outcomes, treatment, all of that. And so that client will sign off on a blood transfusion, opt in or opt out to a blood transfusion for the procedure. So again, a lot of times that's its own consent when we're dealing with surgery versus kind of general admission into like a hospital setting. But again, something that everyone is on the same page about, fully signed and kind of inactive for the client that needs it. All right, good job, you guys. Last question. The nurse in the intensive care unit is caring for a client who is receiving mechanical ventilation and a continuous infusion of Propofol. The nurse should recognize that this medication is administered to option 1, reduce pain, option 2, induce sedation, option 3, decrease nausea, option 4, increase blood pressure. Let us know what you think. What do we know about Propofol? And we will go from there and wrap up. But again, we encourage you guys to come back tomorrow at 3 p.m. Central Time. We'll be doing another question drill set focused on pharmacology. So we're covering all all things medication, a bunch of different medications. So a pretty broad understanding and takeaway from things to know, safety things a lot of the times for medications, safe administration. So be sure and come back 3 p.m. Central Time on your favorite social media channel, and we will walk through those questions. All right, let's go ahead and pull up our correct answer. So again, our correct answer on this one is going to be option 2, induce sedation. So when we're talking about propofol, this is an IV anesthetic. So it's used for procedural sedation, during like monitored anesthesia or the induction of anesthesia. So it's ideal for short outpatient procedures with a rapid onset of action and metabolic clearance. It can also, again, can be used for induction or maintenance of anesthesia, but it has antiemetic, meaning it can make us nauseous, and antipyretic properties, meaning it can make us itchy. And so again, we want to make sure that this medication is given, in a very controlled environment. So when we're giving propofol, again, using it to induce sedation. All right, you guys did great on that. Well done, everybody. Again, if you haven't already, visit us at nursing.uworld.com. Check us out. We have our free trial. You can get a great taste of what uWorld's about with our questions, explanations, lecture videos, NGN items, all that great stuff. And again, be sure and come back tomorrow on Thursday at 3 p.m. Central Time. We'll be going over pharmacology questions. And thanks for joining us. See you next time. Bye.